Initially, when I first started at SGMC 6 years ago, I started as a patient care tech on our neurology and nephrology floor, typically taking care of stroke patients. I did that in 2013, and then I graduated from nursing school in 2014. I worked on the cardiac progressive unit of the Dasher Heart Center. And after I had my son, when I came back, I transferred to the cardiac ICU. And until about a month ago, I was a cardiac ICU nurse, and now I'm their clinical resource nurse. So providing any education that staff needs, helping them get enrolled for classes, and sometimes just being an extra hand, when we need it on the floor. When you're taking care of somebody, it's not just, what's wrong with them. You're taking care of them and their family. You need to check on the spouse that's there holding the hand of the critically ill patient. And I think too many times we get used to just treating what's wrong with the patient. We have to think outside the box and take care of everybody, because then that's how you remember them and that's how they remember you. There's several families that I still talk to today that I've taken care of over the years. They ask me how my kids are doing, I ask them how their grandkids are doing, or their spouse that was in the hospital. The learning experiences, camaraderie. Our physicians really want you to learn. And so if they see something that you've not experienced before, they're gonna grab you and be like, come on, let's go watch this. I'm fixing to bronch somebody, looking down into their lungs. And for a new nurse or a student, that is very educational. And when I taught at VSU, I would try to recruit all the students that I could that wanted to stay in Valdosta. A lot of them, they want to go to Atlanta. They don't want to stay in Valdosta, because a lot of them are from Atlanta. So I just try to show them everything they can at SGMC, whether it be in the ICU, our other ICU, or other floors that they might enjoy. Staying in Valdosta, probably, for me, it has worked out better, because families from here, but it's also a small community. Yes, everybody knows everybody, but that's kind of how you build relationships. There's people that I've grown up with around here that now work at the hospital, and it's like we're becoming that next generation of leadership in the community. We all have become family. Everybody, that gets married or has a child, we all have celebrated it. Those that can go to events that, when they get married, or go see them when they're in the hospital having their baby. It's not uncommon for one of us to go check on somebody that's in the hospital, or if they're not doing well at home. When you see that patient come in and then they're very sick, like my friend, she was very sick, and then now today you wouldn't know. If you didn't know she was in the hospital, you'd have never known anything was wrong with her. But being able to see her basically have a normal life now, that's what we get out of it. Being able to see patients recover and do well.